Hi, everyone. Thank you for joining us today. My name is Jeff Ladolter, and I'm the Program Manager for the National American Indian and Alaska Native Addiction Technology Transfer Center, or the ATTC. I will be your point of contact for technical assistance questions, and my email is on the screen under Contact and Support. This webinar is being recorded. All attendees are muted for now, but when you get to the question and answer section, we'd love to hear your voices. If you do have a question, you can click the raise hand icon on the top toolbar, and then a host will unmute you so everyone on the call can hear you. Before raising your hand, please make sure that you have a microphone enabled on your computer and test it in the recording settings. You can also ask questions anytime by typing them into the chat box. To kick this off, I want to start by introducing Dr. Alec Thundercloud of the Ho-Chunk Nation, who is the Director of the Office of Tribal Affairs and Policy, and William Longinetti, who is a Government Program Officer at SAMHSA.
Sure. Good morning, everybody, and welcome to the Tribal Opioid Response Program Monitoring and Performance webinar. I'm Dr. Thundercloud, the Director for the Office of Tribal Affairs, and this webinar is brought to you by the Office of Tribal Affairs and the Center of Behavioral Health Statistics and Quality. SAMHSA is committed to supporting the delivery of services and resources to maintain and improve the behavioral health of American Indians and Alaska Natives. The SAMHSA Office of Tribal Affairs serves as a point of contact for tribes, tribal organizations, urban Indian programs, and other stakeholders on behavioral health. Leads and supports SAMHSA on actions to improve behavioral health among AIAN communities, and also leads SAMHSA's tribal consultation, outreach, engagement efforts, education, and tribal technical advisory committee activities. I want to introduce our government project officers, William Longetti and Amy Romero. They will divide all of the TOR grantees into the various HHS regions as you see below. So look for your state and you'll find your respective GPO. We're in the middle of hiring our third GPO, but in the interim, William and Amy will be covering all of the TOR grantees. At this point, I'd like to turn over the presentation to Darren Formore. Darren?
Good morning, everyone. Thank you, Dr. Thundercloud. Hello again. This is Darren Formore. I am the project lead for the system responsible for assisting grantees with their program monitoring and performance requirements for the Tribal Opioid Response Grant Program. So as you see here, this training / overview agenda, today I will discuss in detail some information about your program requirements. I'll follow that up with a discussion about what SPARS is, the system that you will report your performance information and data into. I'll talk a little bit about the Government's Performance Results Act, and essentially as to why we are collecting this information. And subsequent to that, I will talk a bit about the program level data requirements, and then for, depending on your program, your client level requirements. Following that, we will show examples of the types of reports and outcomes that are available once your program matures to a point where you have some data that you can download or use it to assist you with improving or managing your program better. Finally, I will show you the different types of trainings that may be available to you depending upon your program needs and requirements. And then finally, we will wrap up and entertain any questions that you may have. Okay, so most of you have already had this information, so I won't spend too much time on this, but again, as you've heard before, the TOR program has the aim to address the opioid crisis in tribal communities by increasing access to culturally appropriate and evidence-based treatment, including but not limited to Medicaid-assisted treatment using some of the 3 approved, FDA-approved medications for treatment of opioid use disorder. The intent is to reduce unmet treatment need and opioid-related deaths through the provision of prevention, treatment, and/or recovery activities for opioid use disorders. The program supplements current activities focused on reducing the impact of opioids and would contribute to the comprehensive response to the opioid epidemic. So following that, grantees have certain expectations in the receipt of SAMHSA funds. Not limited to, grantees will provide and develop opioid misuse prevention, treatment, and recovery support services for the purposes of addressing the opioid abuse and overdose crisis within the tribes. TOR is one of several SAMHSA service grant programs, which intends that these, for those that are doing services, results in delivery of services as soon as possible after the award. In most cases, SAMHSA expects grantees to start providing services no later than the 4th month after the grant has been awarded. The project director in most cases would be the key point of contact that the project officers will be liaison with, and this position requires approval by your project officer after review of credentials by SAMHSA staff. There are several funding limitations and restrictions. Most of you received some of this information, some of the information provided by a grant officer about a week ago for the new grantees. First off, up to 25% of your award may be used for data collection and performance assessment. Only FDA-approved products can be purchased toward grant funds. And finally, funds may not be expended through the grant or subaward by any agencies would deny an eligible client, patient, or individual access to their programs because of their use of FDA-approved medications for the treatment of substance use disorders. So having said that, I'm going to give a little bit of information about the where. So, you talk about who, what, where, and why, and how. SPARS is the where. This is the place where your program monitoring performance data will be reported and housed for SAMHSA. So what is SPARS? SPARS is SAMHSA's consolidated and centralized data resource used by SAMHSA staff and grantees. This allows us to conduct program monitoring, take a uniform approach to managing grant programs, and finally, to improve the use of data and quality improvement, not only for, obviously, grantee staff, but also for SAMHSA staff as well. As you can see, this is the website Those who aren't familiar with it, SPARS.samhsa.gov. The front page here is pretty dynamic. It changes maybe weekly. That front page has a number of announcements that might be relevant to your programs. In addition to that, depending upon how your program is managed, whether it's in CSAT, CMHS, CSAP, or OTAP, you would click the appropriate link to find resources relevant to your program. So I said before, SPARS is our consolidated and centralized data platform. And this is a place where grantees can submit, download their data. They can generate reports, access a number of resources, including Q-by-Q, question-by-question guides. They can download the actual tool. They can look at or request technical assistance. And they have the opportunity to view a number of pre-recorded online trainings that are available to a number of grant programs throughout SAMHSA. Prior to getting a SAMHSA account, you are able to go to the SPARS website and actually take a look at the tools. So in the case of the TOR programs, you click CSAT, you'll have a list of the tools that are relevant to the TOR program, specifically the program level tool, which I'll speak about briefly, as well as the client tool. You can also download the tool from that site as well and print out as necessary. And finally, depending upon the needs of your program, you can contact by telephone or email the SPARS help desk using the information here during the hours of 8 a.m. to 7 p.m. Eastern Time. Typically, things like setting up accounts or account lockouts or resetting passwords, those things can be accomplished remotely by sending an email to the SPARS help desk, or if you already have an account, you can reset your password yourself. So I'm going to talk a little bit about the why. The Governance Performance and Results Act is why we collect this information. So as you see here, there's the act passed in 1993 was a federal response to the need to start collecting performance measuring, monitoring of the programs that are funded by the federal government. The act was updated in 2010 and increased in its purpose, including accountability, performance, program performance improvements, looking at effectiveness, service delivery, reporting to Congress, as well as internal management by the respective agency and funded programs. So it isn't just that SAMHSA has to do this, it's also something that the grantee should keep in mind, because we're collecting this data, but you're collecting it in addition for yourselves. Here's a snapshot of a number of programs that provide client-level services. I've highlighted the most recent opioid-funded programs that are providing client-level services. The Medicaid Assistant Therapy Prescription Drug Benefit Program, MAPIDOA, the recently ended Opioid STR Rapid Cycle Program, and then finally the SOAR State Opioid Response and Tribal Opioid Response Programs. So here is sort of an agenda or highlight of the data reporting requirements overview. So per the funding opportunity announcement, the TOR grantees are responsible for reporting on program level data. I'll provide a little bit more detail about what that means briefly. Only grantees providing direct opioid misuse prevention, treatment, and recovery support services will be required to complete the client level tool. And then finally, depending upon your program's volume and your capacity, SPARS allows grantees to report data via batch uploading. So just briefly stated again, grantees providing direct client level treatment or direct recovery support services will be required to report client level data using the GPRA tool. Provide a brief overview accordingly. But it's not limited to diagnostic information, demographics, substance use services received, types of services received, etc. This data is reported in SPARS, as previously stated. There are two data collection components, program level and client level tools. The program level tools reported quarterly, so grantees can report 10/1, January 1, April 1, and July 1 during the calendar year. And as previously stated, up to 25% of your grant award can be used for data collection performance assessment. So as previously stated, all TOR grantees will report on program level data. And specifically, this tool covers whether or not the grantees are purchasing and distributing naloxone kits. It's really just 3 questions. I'll actually show you how it looks in the SPARS system. So whether or not your program intends to do this, SAMHSA would like to capture this so that we understand what is being done out in the field. And here is a snapshot, a screenshot actually, of once you have your SPARS account, you log in and you click program, TOR program, you'll be able to pick which quarter you're reporting on, so you see that little drop down. And then there are the 3 questions on the program level tool. If you answer no, the rest of the tool kind of grades out, and you provided us that information for that quarter. You have about 30 days from the beginning of the reporting period, so let's just say your program that's reporting January 1, get them to the 31st to capture this information within your tribe and submit it to SAMHSA for that quarter. So now I'm going to talk a little about the client level data collection tool. And again, as previously stated, if this applies to you, if you're providing direct services to client, this is the tool and the reporting requirements accordingly. So all grantees providing client level services report at baseline, 6 months, and at discharge. Grantees are required to achieve at least an 80% follow-up rate. So for example, if you have a target of providing services, direct client services to 100 clients, you should have a target of at least 80 at 6-month follow-up. And in addition to that, doing a discharge interview at any time during the provision of services for all the clients that you provided services to. Here's a breakdown of the client services tool. There are 7 sections that are completed at intake. So your section A, much of this information can be pulled right out of the client's file as necessary. It's your record management. And it's here that you would input the diagnostic information, planned services, demographics, race, ethnicity, age, that sort of thing. And if applies, military, family, and deployment information. Sections B through G, that's our national outcome measures, so it's an asterisk on the bottom. So here you're providing information about past 30-day use of drug and alcohol, family and living conditions, education, employment, income, section D. Section E, criminal justice status. Section F, mental health and physical health problems, as well as treatment, recovery, and or violence and trauma items are indicated here. And then finally, Section G, items related to social connectedness. At 6-month follow-up, you would complete sections I, and then at discharge, you would complete sections J and K. It's very important that the discharge interview is completed because it's here that we get a full understanding of the kinds of services that were received, and it kind of is the bookend to Section A where you put down what your planned services are. So we can, as well as yourselves, can compare what you plan versus what you actually provided to your clients. I stated previously in your follow-up interviews, you enter not only sections A, B through G, but you complete sections I. There are sometimes exceptions to that. For example, in cases where you have some difficulties following up with your client, they're out of action, you lose contact with them, or there's no way to reach them, there are administrative follow-up options available, so you would complete just sections A and I. And again, you'd still have the requirement to complete 80% in these cases as well. Interviews can be conducted over the phone. Typically, this is done with prior GPO approval. In some cases, that might be something that you get prior to even starting your intake. So be sure after this discussion to talk to your project officer about your options for conducting your intakes as well as follow-ups. We talked about this just recently again. When you do your discharge interviews, you complete sections A, B through G, which are your noms, but be sure to complete sections J and your services provided, K. And just like the 6-month follow-up, you do have the options for an administrative discharge in cases where you have difficulty following up with your client. And here is in cases where you do have difficulties following up. Usually we recommend that you take at least a month of inactivity, and what we mean by that, you tried at least, made a good faith effort for about a month of trying to reach the client using all the resources that you have, and then upon that time, you believe that you're unable to complete the discharge interview because the client is unable and willing, then you would complete the administrative discharge interview. And that would be the sections A and then J and K only. As stated earlier, SPARS is the where. So once you achieve your accounts, you report your program level as well as your client information into SPARS. And again, it's just another screenshot of once you go to the website and you're able to log in, this is what you would see. Once your program starts to mature, there are a number of reports that will be available to you. So here's a snapshot of an intake to 6-month follow-up comparison. And these are the noms. This is sections B through G, where you see a comparison of abstinence, CJ, employment, health and behavioral social consequences outcome, social connectedness, and stability in housing. So generally, we'd like to see these numbers go up. So the MAT program did an excellent job. As you can see, at 6 months compared to intake, these numbers tend to trend in a positive direction. Similarly, there are reports for risky behaviors that are available to you. You can look at specific drugs and abstinence. And again, we'd like to see those trend downward, for example. So outside of the first bar chart, the rest of these tend to trend in the directions that you would expect to see after receiving services. Here is a high-level overview of the types of reports that will be available to you. And these are also available to the project officers depending upon their privilege level. So as your program matures, you'll start essentially looking at your intakes, you start looking at your follow-ups, and you're basically just frequency reports, how many and how much. Eventually, you may be interested in who's getting services, your demographics, the age range, genders, those kinds of things. And as you saw from the report examples, you start looking at drug use. Typically, for your program, you'd want to see that because of your funding opportunity announcement, you would expect that your opioid use disorders would be sort of the drug of choice and the clients being served by your programs. And then finally, as your program starts to move into the latter half of your funding, you want to look at your 6-month follow-up change reports and seeing what trends you might see. And it's these reports that might trigger things like the need for technical assistance or training, or just giving yourself a pat on the back because your program is doing such a great job. More sample reports. Here is a combined intake and follow-up rate. It's a little bit more detailed here on your left side of your screen. And this is sort of by number of programs. So in your case, you would only see yours as opposed to all of these. But depending upon your project officer's privileges, they'll have a report like this, and they would see a list of grant programs as opposed to, specific grantees as opposed to grant programs. On the right side of the screen, when you log in, we also have a data visualization report that gives sort of a graphically pleasing overview of the types of clients that you're serving. So you see here at a high level, at the cross top of the screen, you see demographics, intake rate, follow-up rate, and depending upon which tab you click, you can get some very detailed information, but in a way that you can print out and provide an overview that's pretty easy to understand by a layperson. And then finally, I mentioned earlier that there are a number of trainings that are available to grant programs. Most of them are pre-recorded. And so once you get your accounts and you have staff that are new, you're onboarding them, or there's turnover, et cetera, we have online a number of paper as well as pre-recorded webinars that can assist grantees for getting themselves up to speed. Usually these are downloadable, so there's some difficulty with that. You can contact the SPARS help desk that can assist you with printing out or downloading these resources. And this is a screenshot of the training website for SPARS. And on the right side, there's typically a long list of either upcoming trainings that might be available if we were planning such, and or a list of available trainings to your programs. Typically, you can search by your program specifically, or you can search by the tool. So what should you be thinking of now? So next steps. So after this, this GPRA overview, you want to take a look, go to the SPARS website. I would download the tools, download the guides. You might even want to download the code books, depending upon if you have some people that are assisting you with your data, and review those, because you may or may not have questions regarding what applies to your program. Following that, you want to talk to your GPO to discuss any training needs. It might be data related, or it might be clinical related. So again, you want to talk to your project officer about what applies to your program. And then finally, you want to start collecting your information. I stated earlier, you have up to 4 months to really get started. Some of you may be starting now. You may already have accounts now. So that, again, if that applies to you, you can start entering your information once your account is set up. And so that concludes performance managing and monitoring overview regarding your GPRA as well as SPARS. At this time, we open up the phone lines to entertain any questions that you may have. Thank you. Additionally, if you can't think of anything now and it occurs to you later, my contact information is here. My computer.
Hi, LaDonna. Your microphone should be active. Sorry, LaDonna, we are just going to move on, and we'll check back with you a bit later.
I think the phone line just hung up. Can you send him an email and ask if he can hold?
Hi, Veronica. Your microphone should be active. Veronica? As a reminder, please make sure that your microphone is enabled on your computer, and please test it under your recording settings. Veronica, we'll have to get back to you. Hi, LaDonna. Your microphone should be active. I'm afraid we're still not hearing anything, LaDonna. Can you please check that your microphone is unmuted?
We're working on connecting the audio.
Okay, there we go.
LaDonna, I'm afraid we're not hearing you. If you don't mind, would you
Can you hear
type
it?
your question into the chat? Okay, it looks like we have a question from Arlene Kashada. She asks about the 3-month follow-up compared to the 6-month follow-up. Is the 3-month follow-up required for every grantee? Sorry, folks. Thanks for all these questions. I'm just going to try to get our presenters back on the call as soon as.
Type of requesting what type of trainings that the TOR grantees would be interested in, and that would include the training that Darren is mentioning. Darren, would you like to elaborate any more?
Sure. So as I mentioned at the very end of the presentation, things that you'd want to do next is, after reviewing the question-by-question guide, looking at the tool, looking at the code book, and you have some questions. You're hiring new staff, you've had some turnover, etc. You believe that you need something a little bit more detailed, please contact SAMHSA. It looks like we have a high volume of calls or contacts necessitating such. We can plan something in conjunction, CBISC and OTAC can plan something in conjunction where we can work together and more detailed training.
Yep.
I'm sorry, I think you just cut in. Can you tell me what question this is referring to?
I see a question. Would you provide scenarios about what types of recovery services would necessitate GPRA data collection?
First of all, I'll just remind you that you'll work with your government project officers on dealing with those on a case-by-case basis. But for instance, if you are running your own recovery outpatient treatment center, that would be a facility that would provide client-level data. If you're operating a recovery home, that would be also a facility that would provide client-level data. Yeah, we'll collect this question here and we'll provide a response. We'll direct this to our Division of Grants Management. Move forward with this webinar. We're going to collect these Q&As and we're also going to put them up on the website so that they'll be available for you to view later on with this webinar.
Yeah, so in response to the question about if additional funding could be moved into other categories like travel, training, and client support, we recommend that you contact your grants management specialist, but as Dr. Thundercloud said, we will also distribute answers to all these questions after the webinar today.
Are there any other questions?
There is another question about how to access the code book, where to access the code book.
Right. Right. So again, regarding being able to preview the code book and as well as the rest of the tools for your program, you don't need a SPARS account for that. Once you go to SAMHSA, that's spars.samhsa.gov, and you click the data collection tools and resources, it is on that site where you can pull down the program level as well as client level tools if that applies to you. Additionally, within that site, you can sort by code book or question by question guide, and you can download that in PDF or Word, depending upon your needs. We'll be sending out these links as well. And in addition to that, depending upon your requirements, feel free to contact me. My information is on the slide that you see on the screen. And if I'm able to, I will share your questions with your project officer, depending upon the nature of the question.
Okay, the next question is from Christy Riker. How do you begin collecting data for already existing clients?
For your grant program started officially 10/1, 2019. So if you have a client, you would have to do a new intake for that client. You'd also have to do a 6-month follow-up and discharge. And we know that in some cases clients go and they come back. In that case, you would repeat that intake if you discharged them previously. So we know in their cases where that occurs, you'd have to do a brand new intake for that client. Even if that occurs within the same calendar year.
Can they use old data and build it retrospectively? Yeah. Retrospective data.
So if depending upon your grant program, your grant cohort, you can enter your old client data using the current GPRA tool. If you have questions about that or need technical support entering that information, you can contact me or the SPARS help desk.
You don't necessarily have to do a new intake. You could just grab the old.
There's a question, is there a webinar specifically on conducting the interview? This is from Tamara Perkins. Tamara, once you have your SPARS account, you can log into the training resources, and there is a very detailed webinar on a question. It doesn't go question by question, but section by section, and it goes into pretty well very thorough detail about what sections it entails. It indicates the question by question guide. If that is insufficient, as I stated earlier, we can work with OTAP to put together a new training that might be more specific and useful for the TOR program rather than the generic trainings that are available in SPARS. Christy Riker says, what do we do for clients that are still in the program but began treatment before we started collecting data?
That's when they can go back and do it.
So you can, depending upon the date, you can go in and enter that information using the SPARS tool. So again, I'm more than happy to answer any specific questions and scenarios. In this case, you should be able to go in and enter this information retrospectively. And I'm talking specifically about this cohort. Yeah, the first cohort. If this is an old client and you're the new cohort, your accounts will start 10/1. So this may or may not apply to you. But again, we probably have to sit down and have a more detailed discussion about your question.
Well, so
Okay.
So we got a question from Arlene Kashada. How do we know if we are new cohort or old cohort for data input? If you're unsure about what cohort you're in, you can check your notice of award, and that will tell you when your grant term started. If it started in September 30th, 2019, you're in the new 2019 cohort. If it started September 30th, 2018, you're in the first 2018 cohort. But if you have any questions after checking your notice of award, if it's still not clear, we recommend you contact your GPO for more information on that.
So if you are in cohort 1 and you've been collecting data, what you would do with the data collection tool, the GPRA tool, is you would go in and retrospectively fill out those tools the way that your program has been gathering it. You would not have to go back in and re-interview your clients because you probably already are gathering most of the information that you need in the GPRA reporting tool. Moving forward, you would just continue business as normal as a program and gather the information through the GPRA reporting tool. We will offer the links and the resources on how to conduct the GPRA interview, but it is a data collection tool, and so how you gather that information now through your program is probably the most culturally appropriate and culturally sensitive way to do it. So we're not asking you to change the way you conduct business, but we're asking you to collect as much information as possible within this GPRA data collection tool.
I see a question from Christy. We are cohort 1, but we're told not to collect data because the GPRA reporting tool is being updated and that we needed to wait for the updated form. So Christy, as of June, I believe 15th of this year, the tool that is approved for use is currently in SPARS, and as Dr. Thundercloud said, so whatever resources you were using to collect your information, you would now go into SPARS and enter it into the client-level tools that applies to you. So if you were providing services prior to the approval of the new tool, then you would still enter that information retrospectively. So you might have started providing services January of this year. Again, we would still like to have this information. And I think that applies to Ms. Sanchez as well.
There was a question about the process of batch upload.
So depending upon the both the capacity and the volume of your program, batch uploads are available for TOR. If this is something that your program is interested in, please contact me as soon as possible. There's a specific RTI who manages the SPARS website contact that I can put you in touch with, and they have a technical specialist that works through the batch uploading process and can provide a little bit more technical detail as to what are the requirements for your program if that's an avenue that you want to take.
In addition, some of the tribal epidemiology centers are capable of batch uploading. So if your program is working with a tech center, you may be able to work with your tech center to upload your SPARS data.
Yeah, Veronica has another question. Says we have not been using the tool, so do not have the information as we were told. The instrument was not approved.
I think this is the same question that Christy asked, and again, Mr. Riker, again, the tool that's approved for use is approved in June. So if you have some retrospective data going back as early as maybe the beginning of the program, you were providing services, you can enter that information now. So you don't have to do a re-intake of those clients. If you have that information, you can get your account. If you have one, you can start logging in and entering that information. If you need any technical support regarding that, again, reach out to the SPARS Help Desk, your GPO, myself, and we can walk through or work through any technical issues you may have.
It says we do not have the next question is from Krista Riker. We do not have the information to go back and enter retrospectively as well. So there are multiple programs that may not be able to enter retrospectively.
Can you clarify the question? You're not able to go back into your medical record or your behavioral health record to look at your intake? What we're trying to clarify is if you were part of Cohort 1 and you were gathering data and you were doing intakes, what we're expecting is that you will take the GPRA data collection tool and apply it to your assessment or your intake information and crosswalk that into your data tool and then submit that into SPARS. So the way that you've been gathering your data and doing your intakes is probably no different than a standard of care that you do at any facility that does behavioral health care, including yourself. And so that information is what you need to crosswalk into the data collection tool as best you can.
So Aaron has a question. I am going on the SPARS website and I cannot find the actual GPRA form. Can you tell me exactly what it is called?
Okay, so this is Darren Fulmore again. If you go into the data collection tools and resources, and you, for the purposes of how SPARS is organized, I would say click, it's color-coded. If you click the blue or purple CSAT, that'll pull up all the tools related to the Center for Substance Use Treatment. There you'll see a number of tools and resources listed. What you want to look for is the CSAT GPRA client tool. It's also the CSAT GPRA client outcome measures codebook, and you'll see the same thing for CSAT GPRA client outcomes Q by Q.
William, if you're still there, it looks like you have either muted yourself or disabled your microphone. Everyone, I want to apologize for the technical difficulties we've been having. If it wasn't clear before, we are going to take a closer look at each of these questions and send answers in the form of a Q&A.
Hi, everyone. We apologize for the technical difficulties. But again, yeah, we will be distributing the transcript of the Q&A and the relevant links that we've discussed.
Great. We can hear you again.
So, in case we didn't answer this question, Veronica Sanchez had asked, do we begin this process now? It will take some time to develop a process to extract the data from the system. We were told not to use the instrument in June, so we would be starting now. So I think, as was mentioned, to the extent that you can crosswalk the information you have with what's being asked in the GPRA for clients that were already enrolled, we would want you to do so. And then for any new clients, begin using the GPRA tool on those clients.
Before the call dropped, there were questions about where to find the form. So we will be sending out the respective links for all of the tools that are being used by the TOR program. So that will be the program level tool and question-by-question guide and code book, as well as it applies to your program, the client level tool, question-by-question guide and code book. Have any other questions? So in cases where I think I mentioned about difficulty contacting or the impossibility of contacting a client, you would do an administrative discharge for that client. So you would only enter sections A and J and K, I believe. And so obviously you wouldn't have any other information, NOMs, etc. So this would apply in all cases where there's difficulty or the impossibility of reaching the client. You would do an administrative 6-month and or administrative discharge for those clients.
But Darren, was that in response to Allison's question?
And Tamara Perkins had a question. For clients who came into the program in January,
your microphone has been turned on.
Conducted now, or we do not want an intake interview to be conducted now. Just go through the usual intake paperwork and extract as much of the required GPRA data as possible, even though it will likely be incomplete. Yes.
Yes, that is correct. We just want to emphasize we want to collect as much data as possible, and we would encourage you to collect as much data as possible, because as you saw through the use of the tool and entering it into SPARS, you're going to be able to gather a lot of information on your program to assess how well your program is working, and then also to reassess whether or not, one, like Darren had mentioned, if you can give yourself a pat on the back, or two, you may find that you may need to deviate your plans and start putting your resources into something that you may have not anticipated. And so the gathering of the data is going to be very important for you as you construct, your program and the impact that your program is having on your community.
There's another question. Will there be a follow-up webinar detailing the process to enter information into SPARS?
We mentioned earlier that if necessary, we will work with, we being CBIS and OPTAP, can put together something that might be specific to the TOR program that will assist grantees with using the SPARS tool online. The online tool is pretty intuitive. Most of it is point and click. It comes right off the paper version. So once you log in, it's not it's not going to be something that will require a lot of technical support in terms of entering the information. Typically, the support comes with trying to ensure that you have an account, and or if there's some issues related to some of the data questions about whether it's missing or follow-ups and those kinds of things. Actually entering the data shouldn't be much of a heavy lift, but if it is, we can work with you, providing kind of technical support or assistance, making sure that you understand the process.
And I would just reiterate, please contact your government project officers on any focus training that you would like our offices to provide on any particular topic, because our job here is to make you successful in your program, and we want to provide you with all of the technical resources and connect you with our AIA and technology transfer centers to provide you with resources to make you successful in your program.
There's a question from Veronica. Does each item on the instrument get entered as an individual item for each client? So, Veronica, it applies. So there are some items where you would skip it. You'd say no, and you might skip to a completely different section. So it really depends, as each client is unique. So depending upon the interview itself, there may be portions where you may not even see the question, particularly if you do all your interviews using the online tool as opposed to the paper version. Are there any questions, additional questions?
LaDonna, thank you for raising your hand. I think at this point it might be easier if you did type your question into the chat box. So if you do have a question, please type it in now. Thank you.
We can, for some reason, we can hear you now. I don't want to jinx it, so LaDonna, you could still type it in, but I just want to let you know that we actually just heard the system facilitator mention that a hand was raised and you can type it in, so we can try both. I see LaDonna is typing.
Tell them that you'll need to contact your GMO.
So there's a question, what to do about carryover. Yeah, so with regards to carrying over unspent funds from one year to the next, that's a question that you would discuss with your grants management specialist, your fiscal contact at SAMHSA. If you have any questions on how to reach that person, please contact your GPO, either myself, William Longinetti, or Amy Romero. But yeah, that's more of a financial question. So please contact your grants management specialist. Their contact information is on the bottom of your notice of awards as well. So for Cohort 1, the 2018 grantees, your grants management specialist is Gwendolyn Simpson. And for the newer 2019 cohort, your grants management specialist is Nicole Cleveland. So you can contact either one of them for questions about your carryover awards.
Are there any other questions? We can try it verbally and see if that works.
Sure. LaDonna, you are unmuted. If you would like to enable your microphone and ask a question.
We may have answered LaDonna's questions. Are there any others? Anyone else have their hands raised or have any questions related to the GPRA tool measures? Are you fielding any new questions? Okay, well, then again, to reiterate, feel free to contact me. My information is on the screen, or your project officer, depending on the nature of your inquiry. We thank you again. This is Darren Fulmore from CBIS.
And this is Dr. Thundercloud from the Office of Tribal Affairs and Policy. And within the next week, this PowerPoint presentation will be housed on the American Indian and Alaska Native Technology Transfer Center website. Thank you, everybody, and we'll close the call now.
Oh, all right. Thank you very much. And as a reminder, we will be sending answers to these questions in the form of a Q&A like we did for our last webinar.